Hello, this is my in service project. My name is Shatia Wydell, and the subject I decided to talk about today is PCOS. So, this is my PCOS in service. All right, first, you may ask, what is PCOS? Well, and what does it stand for? I'm going to get to that. PCOS is polycystic ovary syndrome. It is a hormonal condition that affects women of reproductive age. And then I have an example, as you can see. All right, second, how is PCOS diagnosed? Well, there are plenty of ways that PCOS could be diagnosed. You first have clinical evaluation, where you go speak to a doctor, go to a clinic or whatnot, and they have an evaluation. So they ask you about any irregular periods, if you have acne going on that's irregular, anything that is irregular, facial hair, excessive hair, things of that sort. Then they have a physical exam where they check it for signs of acne, facial hair, and high androgen, etc. Then you have the pelvic exam to check for enlarged ovaries and other abnormalities. Then we have blood tests and ultrasound. I have an example up here that basically states the same thing that I just so we know we can get the concept. 3. What are the symptoms, you may ask? All right. Menstrual irregularities, so irregular, missed, or very light periods. Ovaries. Ovaries that are larger than normal. So larger ovaries and ovaries that consist that has many cysts. Um, Hair growth. Excessive hair growth on face, chest, stomach, back, or buttocks. Yikes. Weight gain. Now, if you notice a little weight gain that's not normal around the waist, around the belly, that is a symptom. Skin, acne or oily skin, hair loss. You can notice a male pattern baldness or thinning hair, a sleep problem, not getting much sleep, poor sleep or insomnia, and signs of like depression and anxiety. Then I have another example right here, just so you can like get the gist and then you understand. 4. Can PCOS be cured? You may be asking. Well, unfortunately, PCOS cannot be cured, but there are many ways that symptoms can be managed within lifestyle changes, medication, and fertility treatments. So, don't get sad yet. There are ways, there's possibilities. Treatments. So, I have listed 2 treatments. Now, um, anti androgen medicines, I believe I'm pronouncing it. This medicine will block the effect of androgens and can help reduce scalp hair loss, facial, and body hair growth. So it would help stop that. Well, not stop, but keep it to a minimum. Now, these medications are not approved by FDA to treat PCOS. So there's risk. The risk of taking these medications could cause problems with pregnancies. So be careful. Then we have metformin. This medicine is often used to treat type 2 diabetes, but it would help with some women with PCOS symptoms. It helps improve insulin ability to lower your body sugar, insulin, and androgen levels. There are little effects of acne and extra facial hair or body hair. Then we have PCOS treatment options to your right, understanding the options and management systems of PCOS. And this chart gives you options. 6, causes. You might be wondering, well, what is causing all of this? Why is this happening? Well, sadly, there is no exact known cause for PCOS, but there are some factors that could play a role. So, excessive androgen, having PCOS, your ovaries could produce high levels of androgen. Having too much androgen interferes with ovulation, meaning that it affects the eggs, but not developing on a daily basis. So it affects the eggs from developing on a daily basis, and they aren't released from follicles where they develop. Now, it also could be passed down through genes. There is research that suggests certain genes may be linked to PCOS. So having a family history of PCOS may also play a big role in developing this condition. Low-grade inflammation. When white blood cells make substance in response to an infection or an injury, researchers say that people with PCOS have a type of long-term low-grade inflammation that leads to polycystic ovaries to produce androgen. Now, then I also have an example right here. It states the 5 causes of PCOS: insulin resistance, inflammation, stress could play a part, poor health as well. 7, complications. What are the complications that come with this PCOS? Complications can include gestational diabetes or pregnancy induced high blood pressure. Second, infertility. 3, type 2 diabetes or pre-diabetes. 4, cancer of the uterine lining. 5, metabolic syndrome. I also have an example of more complications, more to similar of what I've already stated. Now, you might be asking, how does PCOS affect pregnancy? Well, I'm going to get to that. PCOS can cause problems during pregnancy, not only for you, but also your baby. You are at higher risk of miscarrying, so there's higher risk of having a miscarriage with PCOS. As I stated before, gestational diabetes. You can also have a C-section, and another thing is preeclampsia is another. But now to your child. Your child is also at a higher risk of being heavy. So macrosomia and possibly spending more time in the NICU unit. Then I have an example with more effects to similar effects. Miscarriage and stillbirth. You could also pass on PCOS to your child. Your child could be born at a large birth rate. These are all things that could affect your pregnancy. So, dealing with PCOS. Are there ways to prevent problems during pregnancy with PCOS? You're probably wondering, and I'm here to inform you. So, there are some ways you can aim to reaching a healthy weight before attempting to conceive. Maintaining a healthy diet, eating lean protein, whole grains, fiber, and less processed foods. Try to engage in moderate intensity exercises daily, most days out of a week. Whatever helps you, but as long as you are engaging in a moderate intensity exercise during that week, more than I would say twice, but work at your speed. Attend regular prenatal appointments so you can keep up with you and the baby and what's going on with the baby. And take your prenatal vitamins to prevent defects, please. Then I have an example of how to prevent miscarriage with PCOS, and it states some more. Getting getting rest is another thing. Staying hydrated is another thing. You know, all of these things help you and the baby remain healthy. And here is my cited page where I got all my information from. Also, I got my information from the book that we was reading during out of this year. And this is the end of my presentation. Thank you.